open the floor for questions, and we've already received a number of questions. And let me just let me start with the most important questions in my views, and I think we have it already on the list. As clinicians, we have lots of benzodiazepines which we have been using for many years. What would tempt us or encourage us to choose Sedoxil or Mexazolam as an alternative benzodiazepine? In other words, what can it provide which we don't already have?
Okay, thank you very much for the question. So first, it's anxiolytic efficacy. So it is a drug that is effective in reducing anxiety symptoms. Second, it is easier to discontinue when compared with other benzodiazepines, mainly when we thought about alprazolam, lorazepam, which are very hard to discontinue. We can prefer this type of benzodiazepine because mexazolam is really easier to discontinue. And finally, this is a benzodiazepine with less sedative, psychomotor, and cognitive adverse effects. So patients can be more active, and in the elderly, we can also prevent the falls and the fractures related with this type of events.
Great. Another question I think it's an important question. It's not on the list, but I think many people would be asking, because one of the things which have been said about Sedoxil or Mexazolam is, I don't know where the source of this information is, it's only effective in the first 3 weeks. And after the first 3 weeks, its efficacy is not different from placebo. What is your comment on that, Prophet?
We don't agree at all with this perspective.
Sure.
So here in Portugal, all the benzodiazepines are recommended to use only for 12 weeks. And Mexazolam, like other benzodiazepines, should be used for short periods. But its efficacy lasts for over that 3 weeks. So we usually use it for some months in order to improve the patients and to provide them the symptom reduction that is available at the maximum opportunity, and the efficacy lasts for the entire period of use. The risk of tolerance is lower using these long-acting and less sedative benzodiazepines when compared with other types of benzodiazepines. So I would say that the anxiolytic effect of Mexazolam usually lasts longer than when we use the more sedative benzodiazepines.
Great. Another questions we have received is, I think it's about the long half-life. I mean, I understand, and correct me if I'm wrong. I mean, there are two half-lives depending on the metabolite we're talking about. So a half-life of 1.5 hours and another half-life of, as far as I can remember, 70 something. Can you just shed some lights on that? Because it's a little bit confusing for some people.
Okay, so when we look at the half-life, there are two main characteristics that make this drug useful. First is the time to action. So how many minutes or hours it takes to have an impact on the patient's feelings. And this is critical for addiction and dependence, because when we use benzodiazepines that are very quick to act, the risk of developing a dependence is higher than when we use a benzodiazepine that takes some more minutes or hours to initiate their anxiolytic effect. So when we look at Mexazolam, it takes more or less 1 hour to to make some effects that the patient could feel in the anxiety symptoms. So it's not a fast-acting benzodiazepine in the reduction of anxiety. So the patient have to deal and to learn to cope with anxiety, because when we are using mexazolam, it takes these 60 minutes to reach the peak that makes the patient improving. This is very relevant because this is in line with the perspectives from the cognitive behavioral therapy, and this is the correct way of treat anxiety disorders, in which we should avoid that fast-acting benzodiazepines. The other thing is that when used continuously, the half-life is much more longer. And this type of half-life is critical for discontinuation, because benzodiazepines with shorter half-lives are related with higher frequency of withdrawal symptoms. So when we are thinking about the discontinuation, we should prefer this type of longer half-lives in terms of benzodiazepines, because they will ease the discontinuation. And another issue is related with the frequency or the occurrence of withdrawal symptoms between doses of benzodiazepines. When we use that short-acting benzodiazepines, patients could experience some withdrawal symptoms even between taking the drug. And this is another advantage of this longer duration of action or half-life of mexazolam.
Great, thank you very much, Prof. Another question we've received earlier today, I will pose it to you, but I will just very quickly try to answer from my clinical perspective as well. The question was about the difference between depression and anxiety. I'm not sure the question was directed by a non-medic or non-clinician, but it's still a very valid question, because from my experience, we tend to normalize anxiety. We all do feel anxious from time to time. And we have our own coping strategies to deal with anxiety. And there is no cutoff point between normal anxiety or abnormal anxiety or pathological anxiety or morbid anxiety. It really differs, and it depends on lots of things. But what I really notice in my clinic is a lot of people who come complaining of anxiety, they don't see it. Obviously, when they come to me, it reaches a clinical significance. So they don't see it as a problem. They look at it as part of my personality. That's me. I've always been like this. I'm shy. I tend to get worried excessively or quickly or readily, and lots of physical symptoms. And they have normalized it for so long. And the sad thing is, a lot of them only come to seek help when they actually become depressed, because we know for sure that anxiety is a very high risk factor for depression. So the bottom line is, anxiety is a normal feeling, and it's very difficult for people to, because there's no specific cutoff point, whereas depression is a very morbid pathological condition, and many people go through their life without experiencing depression, the clinical depression, which is obviously 2 weeks of low mood, anhedonia, and excessive tiredness, plus other symptoms as well. And actually, it becomes like a wake-up call. Some people may have anxiety for long term, and then they get depression on top of anxiety, and only when they get depression, because it's quite pathological, it's quite morbid, they start to have feelings of, they don't want to live, they want to kill themselves, they don't have any energy, so they seek help. But actually, if we look deeper, we will find that they have an anxiety much longer than the onset of the depressive symptoms. So that's my just clinical perspective on this question, and I will ask for your kind opinion about this question if you want to add something.
Yeah, I completely agree with your views on the depression and anxiety. And the time to diagnosis in anxiety disorders is usually higher than in depression because people tend to normalize it and to not recognize that this could be pathological. But the two most relevant things in my view are the impact on the personal functioning. So if the person is not able to cope with anxiety symptoms, and if these anxiety symptoms impact negatively on his or her functioning, probably it is the case of a pathological anxiety, and it requires a diagnosis and a correct management. The other thing that you mentioned, and I completely agree, is that the prognosis of anxiety could be very good if we treat it correctly, but could also evolve to and progress to depressive situations, to drug dependence, and to other conditions that have very bad prognosis, and could arise other types of problems for our patients. So detect and diagnose anxiety is critical to prevent this natural evolution, and to prevent this type of heart problems to manage in the clinical practice.
Great, great. Thank you very much, Professor Morgado. Another important question is about the use of benzodiazepines in general during pregnancy, but obviously, so long as we are talking about Sedoxil, also the question will be more specific to Sedoxil. Do you have any previous experience, you as a clinician? I'm sure you have used the Sedoxil because I understand that it's available in Portugal. So do you have any clinical experience of using Sedoxil in pregnancy, and where does the literature stand on that topic compared to the other benzodiazepines we are familiar with?
Okay, so we use Sedoxil for decades here in Portugal, so it's one of the most used benzodiazepines. And in pregnancy, we don't have studies that support our clinical decisions, but this is the reality for almost all benzodiazepines and for other psychotropic drugs. And we used it in some situations. We assessed risk benefit for short periods, but it is not approved to use in pregnancy here in Portugal. So we can use out of approval. So it is possible here in Portugal. I don't know about the Emirates regulations, but here in Portugal, we can use any drug out of approval and take the responsibility to do this. And we, as I was mentioning, we have this experiencing of using it in some specific situations. And it is similar with lorazepam, which is another benzodiazepine of use here in the pregnancy, and we haven't seen differences between those two drugs.
Great, great. Another question just came through now is the equivalent dose of mixazolam. Obviously, we use diazepam as the benchmark, and we give a rough guidance in terms of the dose equivalent. So what would you say the dose equivalent of Sedoxil compared to the benchmark Valium and the most commonly used ones like Xanax, alprazolam?
Okay, in my view, the equivalent doses of 1 milligram of mexazolam is 5 milligram of diazepam. This is the most used equivalent dose here in Portugal.
Great. Another question about the. Let me just get the full questions. It was one of the first questions we had. And it was about what are the advantages of, I think probably we've covered that, but the question is specifically about the advantages of Sedoxil over two specific benzodiazepines, which are quite commonly used here, actually in UAE as well. I think in my mind, I think they are most commonly used benzodiazepines in the UAE, which is Xanax and Laxatinil. I'm sure that the people who practice here in the UAE will agree with me that that's the most commonly prescribed benzodiazepines. So the question is, what is the advantages of Seluxil over them?
Over Xanax is alprazolam, I guess.
Yeah, Xanax, alprazolam, and the promazepam, the Laxatinil.
Okay. As I mentioned in my presentation, the efficacy of mexazolam is similar with alprazolam, and it looks like somewhat higher than bromazepam in terms of efficacy in the reduction of anxiety symptoms. But the main advantages with mexazolam are related with the facilitation of discontinuing. So when we start alprazolam or bromazepam here in Portugal, we fear a lot that it would be hard to stop these drugs because patients really like it and experience some relevant withdrawn symptoms. And that's the main advantage. So it's really easier to discontinue when we use mexazolam compared with alprazolam and with bromazepam. The other advantage is related with sedation. Despite alprazolam and bromazepam are not so sedative as other drugs like midazolam or lorazepam, they still have some sedative properties, and they have some symptoms related with cognitive and psychomotor function that does not happen with mexazolam. So the main advantage related with the higher control we have in the treatment. So we can decide easier when to stop this treatment if we are using mexazolam than when we are using alprazolam or bromazepam. A final issue which related with this is that with alprazolam and bromazepam, patients usually take it over the count and increased by themselves the doses when they feel anxious or when they experience some anxiety symptoms. And with mexazolam, this is not so common, and this is another advantage.
Right. Another question is, Prof, about the onset of action. Are there any differences in the onset of action compared to other benzodiazepines, particularly like Xanax or Laxatinil or Valium, in terms of how quickly it can produce or bring about its therapeutic effect?
Okay, it is similar to Valium. It is a little bit longer than Xanax or Lexotan. So Xanax and Lexotan have an onset of action which is more quick than Valium, and mexazolam is similar with Valium. So it takes up to 60 minutes to make an effect. In some patients, it is earlier, but it is a little bit longer than Xanax or Lexotan.
Great. Another question about we shed some light on its use of pregnancy, and you mentioned that it's prescribed as a it's unregistered or non-licensed, so it will be prescribed off license in pregnancy. What about lactation? Does the same apply? Do you have any previous experience of using it in lactating women, or is that something you like as a clinician you haven't used?
Okay, the issue is the same as in pregnancy. It is off license for lactation, and we don't have studies that measure the levels of the drug in the milk, but we use in some few situations. Usually in lactation we prefer lorazepam because it is licensed here in Portugal, and we can use it with more confidence when related with mexazolam.
Great. Another question about obviously mexazolam and COVID, and I don't think that there is anything. I mean, it's it's something I think too early to judge, but it's a question, so I have to ask you that question about mixazolam and COVID. Any different if you happened to use it with any patients who may have COVID? Any previous experience?
I can share that I'm following some patients who have COVID and then developed some depressive or anxiety syndromes, which we can relate with COVID, that long-lasting COVID syndrome that has been described. And in these patients, we use the same treatment as we used for other situations of depression and anxiety. So when anxiety symptoms are present, we consider the use of mexazolam without any constraint or any problem. So in these cases, we have that experience. On treating active coronavirus infections, I don't have so much experience because patients are treated in another department of our hospital, and I don't have that experience.
Great. There's another question. I hope you don't mind. I just have my perspective on it. Then I will ask you if you can kindly give us yours. It's about the use of Sedoxil in the management of pain and sciatica and back pain. I'll talk about it from a general perspective, because obviously I've never used the Sedoxil before, so I'll talk about it from the general overview of using benzodiazepines. Obviously, there's a very big correlation between the pain threshold and the level of anxiety. We know for sure that people who have high levels of anxiety, they have a low threshold for pain, and the other way around. So anything which will reduce people's level of anxiety, it will definitely reduce their perception of pain, and therefore it can be used indirectly. Obviously, it's not a painkiller, but when people complain of physical pain, which we think could be related to high levels of anxiety or stress, we can use anxiolytics or benzodiazepines for short term. So I don't know whether you want to say anything about that, Prof.
Yeah, I completely agree with your view on the relation between pain, anxiety, and I would have depression. So patients with depression, patients with anxiety disorders have a higher sensitivity to pain and have a higher frequency of pain disorders too. So treating correctly anxiety and depression could lead to an improve on the pain symptoms in our patients. We use Sedoxil in these patients, and the results are really good. Another thing that I would like to mention when related with these pain disorders is that, unlike diazepam, Sedoxil does not have muscle relaxation properties. So when we are thinking in use a benzodiazepine to muscle relaxation, we should think in another option such as diazepam. But to reduce the anxiety related with pain or to improve the pain symptoms indirectly, we can thought in Sedoxil, and we often use it to treat anxiety symptoms in these patients.
Great. I think that's a question about it's not a question, it's like a comment. One of the doctors here, Dr. Nesreen, believes that based on what she understands from Sedoxil, its effect will be closer to buspirone rather than a benzodiazepine. What would you say about that?
In some aspects, it's true. So the low risk of dependence, the low sedation and psychomotor and cognitive effects, in this way, it is similar. But in my view, Sedoxil has more efficacy in anxiety reduction than buspirone. I don't know what is your experience. Buspirone is not a very used drug here in Portugal. We use it in a very small number of cases, and we don't have so much experience using buspirone because due to the lack of efficacy. And when we compare buspirone with Sedoxil, the benefits of buspirone are present in Sedoxil with this plus, which is the effective anxiolytic effect in the anxiety reduction of our patients.
Great. I just very quickly touch on my experience with buspirone. I've used buspirone both in the UK and here in United Arab Emirates. And from a very personal perspective, I really didn't have much luck when I used it. Obviously, there is the evidence there for buspirone. No one can deny that there is some evidence that it can be used, and it's a medium-term option for anxiety. But unfortunately, I didn't have much success with buspirone, either here in UAE or in the UK. I'm not sure about, we can actually open the floor later on about people's experience, but that's my professional opinion about the use of buspirone. Right, another question about the use of Sedoxil as a hypnotic tablet, as a sleeping tablet. Okay. Is it something you have experience with, or do you use it more as an anxiolytic medication?
Yeah, it is not an hypnotic drug at all, but we use it to improve the sleep of our patients, because in many situations, patients does not have a sleep disorder, and the sleep symptoms are only the consequence of elevated levels of anxiety at the evening. So we use Sedoxil to reduce the anxiety levels before sleeping, but not as an hypnotic drug. So the mainly use is as an anxiolytic drug and not as an hypnotic drug. But as I mentioned, in lots of cases, the sleep symptoms are only related with higher levels of anxiety. And in these cases, it is really useful because it not induces sleep artificially, but it reduces the anxiety, and then the sleep goes naturally and improves a lot using this strategy.
I can't agree more on what you said, because it's exactly the case. People who have difficulties with anxiety, with the sleep, any insomnia, particularly initial insomnia or broken sleep, the majority of the time, if there's no organic cause for it, there is a mental health issue, and most likely it is an anxiety. And when we give an anxiolytic medication and reduce the high levels of anxiety, as a consequence, people are more able to sleep. And actually, from my own experience, because we have different tablets we can use empirically to aid sleep, starting with a small dose of Seroquel, small dose of mirtazapine, amitriptyline, or the Z medication, or benzodiazepines. And in many cases, actually, I opt to use benzodiazepines simply because the insomnia is mainly caused by the high levels of emotional arousal and anxiety. And also, the problem with the Z medication is you get some strange experiences. Some people have something more or less like hallucinations, or they wake up in the morning and they don't realize what happened the previous night. And obviously, with some medications, particularly Zopiclone, you have a bitter taste. So when the insomnia is related to anxiety, which is the case in the majority of the patients I see, I prefer to use a short course of benzodiazepines in the first 2 to 3 weeks, while the SSRI or the SNRI take its course to achieve or to bring about the desired effect. Right. There is a question, but I'm not sure you'll be able to answer this question. We'll have to leave it for the team here, because it's about the whether it is available in Abu Dhabi or the United Arab Emirates in general, and will it be covered by the Thiqa, which is the national insurance. So I'm sure that our team members will be able to answer that at the end of our seminar. But for the time being, I think we've covered most of the questions. There is another question coming now about its use in phobia of traveling or other kinds of phobia. Do you have any previous clinical experience, or are there any specific views or findings from the literature about its use in phobias?
In phobia, yeah, we use it in phobia, specifically in phobia of traveling, which is a quite common condition here in Portugal. And usually we used it combined with cognitive behavioral therapy, which is the first line option for treating phobias. But in order to reduce the anxiety levels in some situations, and in the beginning of the treatment, in which the patients sometimes have to combat the phobia because they have to travel for work or they have to travel for family duties. So in these situations, we use Sedoxil to reduce the general anxiety levels before the traveling, and then we keep on with the cognitive behavioral therapy. So it is an option for phobia too.
Right. There's a question about its use, Sedoxil use in bipolar patients. And if I may say very quickly before we listen to what you need to say about that, I think bipolar, obviously, the main treatment, as we all know, is mood stabilizers, and we have first line and second line and third line. But obviously, if anxiety is there and it's problematic, then we use benzodiazepine in general. But I'm not quite sure whether you have any specific experience about the use of Sedoxil with patients with bipolar.
Yeah, I completely agree with your views, but in some situations when the anxiety is difficult to control using antidepressants or mood stabilizer, because here in Portugal we are now using antidepressants in some bipolar depression when the risk benefit goes through its utilization. And in some situations, until the effect of the antidepressant in the treatment of depressive or anxiety symptoms, we use Sedoxil in order to promote a faster relief of symptoms in our patients. There is no contraindication for use Sedoxil for short periods in these patients, so we are used to use it in these situations.
Great. There is a question here about the whether or not we can combine the use of Sedoxil with Z medication, Zopiclone or Isopiclone or Zolpidem. Do you have any experience of using both of them?
Yes.
Simultaneously, I mean?
Yes, we can use it simultaneously without any problem, because as I mentioned previously, they have different actions and they complement each other. So in some situations, we combine it without any problems.
Great. I think there's a question about, this is a general kind of questions about the relationship between mitral valve prolapse and anxiety. And we all know that there is some link between the two conditions. But so long as we had the questions, do you want to say anything about that? Have you come across some of your patients who have mitral valve prolapse, happen to have mitral valve prolapse, and a comorbid anxiety, and they were treated with Sedoxil?
I have a few patients with these cardiac conditions, including mitral prolapse, and the use of Sedoxil is not contraindicated, and we can use it without any specific concerns.
Great. I think probably this is the last question, and I think we can go after that for the team to fill us in about the launch in United Arab Emirates, when people can expect to see it in the market. But the question is, we know that when people are dependent on short-acting benzos like Xanax or Laxatinine, we prefer to calculate the equivalent dose of diazepam, and then starting them on a reducing regimen of benzodiazepine reduction. So the question is about Sedoxil, bearing in mind it has a longer half-life. Have you ever used that as the same way we are using Valium?
Yes, we use Mexazolam and Sedoxil for the same purpose, to reduce the intermediate and the short duration of action benzodiazepines here in Portugal. So almost all international guidelines mention diazepam, but here in our experience, Mexazolam is a very good option to do this reduction. I would recommend to use a little bit more than the equivalent dose when you make the switch, because for example, in the case of alprazolam, there are some literature that mention the equivalent dose is 1 milligram of Mexazolam, 1 milligram of alprazolam. I don't think so. I think that the equivalent dose is somewhat between 0.5 and 1 milligram of alprazolam. So if patients are with 0.5 milligrams of alprazolam, I would prefer 1 milligram Mexazolam and then reduce it safely for our patients. But we use it a lot to reduce other benzodiazepines.
Great. So there are a couple of questions we can touch on very quickly. One of them we've already talked about, which is the use of medications or anxiolytics in pain. But this question is specifically asking about any advantages in chronic pain treatment. So, I mean, I'll just say something about that before before you can talk to us about your experience with chronic pain and whether or not you have used Sedoxil. But in general, obviously, chronic pain, we all know that benzodiazepines are indicated for short-term use. So if people have chronic pain and we start to use benzodiazepines, I do not think it's going to be a sustainable strategy. And for chronic pain, I think the most evidence-based is CBT, or particularly the mindfulness-based stress reduction, and it has been tried for many years with great efficacy. So I don't know whether you have anything to share with us about chronic pain and anxiolytic medications in general, and Sedoxil in specific.
I completely agree with your view. Benzodiazepines are not treatments for chronic pain, so we can use it for short periods just to manage some anxiety symptoms that arise. But it is not a treatment for chronic pain at all, and we don't use it for this purpose.
Great. Last question is about mild anxiety, and again, I mean, I think mild anxiety is something, in the majority of cases, we use non-pharmacological strategies, lifestyle changes, developing or maintaining positive coping strategies, CBT, and I do not think that benzodiazepines are specifically indicated for mild cases of anxiety. I'm not sure whether you would agree with that or not, and if you have any thing to add about the use of Sedoxil for mild anxiety. Obviously, my answer was based on benzodiazepine in general, and you are the expert on Sedoxil, so please share your views.
But I again agree with you. I think that our perspectives in psychiatry and the management of psychiatry disorders is quite similar, and this is really, really good.
Fantastic. Right. Prof, thank you so much for your time. We really appreciate it. It has been my pleasure to be with you and with all the audience. I really enjoyed being here, and I wish we have more talks to come and more discussions, and maybe one day we can work together on some kind of research. But before I hand it to the team, I would love to announce the winner for our competition. The winner is Dr. Rafat Ammar, and ProPharma will contact him to receive the voucher. I thank everyone. I thank the organizers. I thank Dr. Muhammad for giving me this opportunity to be with you. I thank Prof. Pedro, and I thank everyone. And I think we have more than 250 attendees, which is fantastic. And I'm not sure whether Dr. Muhammad, would you like to chip in and say something?
Well, thank you very much, Dr. Omar, for sharing the session and putting your highlight and feedback on this important topic, and Dr. Pedro for his excellent speech. We will share the questions that and the answer to all the audience who we are with us tonight, and we'll send it to Dr. Pedro to complete the answers and share it with both of you and with the attendees. So that this nice Friday night, thank you very much for coming and attending this seminar, and hopefully we'll be with you again in the near future. Thank you,
Muhammad, can I just ask you about when will Seduxil be available in UAE and Abu Dhabi in specific, if that's something you can tell us about today?
Yeah, it's already available in pharmacies in Abu Dhabi, and it is coded by the DOH and is covered by Tiqa and other insurance companies.
Great, that's really good to hear.
Yeah. Thank you very much again, and thank you for the excellent presentation and excellent moderation and sharing this session, Dr. Omar.
My pleasure, Dr. Muhammad, and thank you again, Prof. Morgado. And it's been a pleasure seeing you and talking to you today. And I'm sure there will be so many other opportunities where we can meet and exchange and benefit from each other.
Thank you very, very much. The pleasure was mine, and I hope so too.
Thank you very much. Have a good night.
Bye.
Okay, bye-bye.